So at this point in the project, we have developed the metric steps, errors and critical errors, and been through the procedure characterization, had the Delphi consensus meeting. So it's time to start the online course build. So I worked quite closely with Dr. Dorothy Breen and Advanced Nurse Practitioner Claire Costigan in developing scripts, as well as with Flux Learning, to develop a storyboard or a script for a simulated safety huddle. And we also went back to the wider Protect research team with the multiple choice questions that we'd also developed based on the scripts. And all of this put together formed the online course. So with the scripts, we needed to ask very nicely some of our colleagues to take part in a simulated safety huddle. So in effect, they were acting. And you can see some of this footage from the simulated safety huddle in some of our vlogs that we've already put out. So every step was recorded as part of the simulated safety huddle. And we also recorded some errors and critical errors because they are just as important for training, and we use them in part of the assessment and built MCQs around both the correct steps and the incorrect errors and critical errors that could be made in this communication tool. So when we were recording the simulated safety huddle, we were limited in the venues that we could choose to record. We ended up recording the simulated safety huddle in the Assert Centre, which was a suitable location as it is essentially a mock ward. Because we were recording in the middle of COVID, there were a number of restrictions and guidelines we had to follow, and as such we were limited to a certain number of people that we were allowed to have in the Assert Centre in the mock ward recording at one time. And as well as that, we also had to wear face masks. So for a communication skills training course, it wasn't ideal. You couldn't see full facial expressions except for eyes, but we did the best that we could. Unfortunately, due to the COVID restrictions on the number of people allowed in the room at the time, we couldn't have all of the representatives from each of the disciplines, nursing, medicine, allied health, etc., represented in the safety huddle. So we were restricted there in the recording for the online course. By the time it came around to enrolling participants to the online course, some staff members who'd been working on the ward or who are there based in 4B most of the time, such as the nurses, a lot of those healthcare workers had already been recruited, but there's some more transient members of the healthcare team, such as medical interns and even physiotherapists, pharmacists, who tend to move around the hospital. So while some staff members were more familiar with the study than others, it meant getting new staff members involved in the project and explaining to them what was involved, what their role would be and what was expected of them if they were to take part. Of course, participation was voluntary. On top of an already busy healthcare system during the winter months, the training also flowed into the third wave of COVID. This was the end of December 2021, January 2022. The healthcare workers who we were asking to take part were already extremely busy. There was huge staff absences at the time because of COVID, and we were asking them to take time out of their day, not only to complete the online course, which took approximately an hour, which many members of staff had to do on their own time. So that was a really big ask, and everyone was enthusiastic to take part in the research project because they wanted to do something and be part of something that would contribute to safety improvement in the ward. But there was, as it fell during the COVID wave, they were conscious of the enormous pressure they were already under due to their heavy clinical workload. So this was over and above what they were expected to do at their job with their work each day. So the fact that we got over 80% of the workforce based on Board 4B in CUH to take part was an enormous achievement for not the project, but for the staff themselves to take part in something and work together to try and improve the standard of care that's delivered on the ward, and trying to improve their team communication skills by taking part in the Safety Huddle training programme. We explained to each of the participants as they consented to participate in the study that they'd have to progress through the online training course step by step and phase by phase. They also had to watch all of the videos that we had made from the Simulation Safety Huddle in the Assert Centre. They were broken down phase by phase in the online course. And afterwards, the participants had to complete an MCQ or multiple choice assessment at the end, and they could not progress onto the in-person simulation training without having reached the proficiency score in the online training.
My name is Geraldine Hennessy, and I'm a Technology Enhanced Learning Project Manager with Flux Learning, and I've been working on the Protect study. I worked in various aspects of creating the online learning element of the Protect study. We designed and developed a proficiency-based progression course on a WordPress-based LMS developed by Dave Hick called LearnHub. The course features a reference huddle being conducted with each metric step clearly identified and contextual information provided. The course features a quiz-based assessment, including feedback per question. The assessment also used video footage of steps, errors and critical errors, as per the metrics, to serve as the stimuli for authentic assessment. We opted for a scripted reference procedure. Whilst a scripted reference procedure is not always possible in a clinical setting, we were able to do this in this instance. We set up a safety huddle to mimic how it would occur in the hospital. Doing it this way allowed us to achieve better quality audio and video. Having scripted procedural footage ensured that the metrics were performed and made it easier to break up afterwards in post-processing. The procedure was first captured for the entire huddle, followed by the errors. We were then able to break up the captured video into individual step videos and individual error videos. These videos were then used to form the basic learning element of the online course. As part of the online course, additional videos from various medical professionals and experts were also included. The challenges we faced for the recording of these videos was they had to be recorded during the COVID-19 pandemic, so these could not be done face-to-face. The recordings were conducted either in the subject matter's home or office. As a result, we were unable to control the quality of both the audio and video. We also could not control consistency over the various videos, as the final video output depended on the circumstances and available technology of the subject matter expert. We built the course on Flux Learning's learning management system, Online Learning Bootcamp, which was developed by LearnHub. The benefit of the platform to the learner is that it's intuitive with a clear structure and easy to use. The Health Huddle metrics were divided into phases. Each phase had a video of that phase's steps and reference procedure. The steps were also noted in text under the video. Supplementary videos, optional information and additional resources were also included in the course before the final PBB assessment. The platform ensured an unambiguous and inviting learner journey from enrolment through to completion of the assessment to proficiency benchmark.